Good afternoon. My name is Corina Herrera Loera, Public Information Officer with the Emergency Operations Center here for Santa Clara County. Today we have another exciting segment. We have a guest who I will be introducing shortly, but before we go there, we're going to go over our updates for COVID-19 cases, vaccines, and other information here in our county. So we can go to the next slide. Here, we show that as of April 26th, these are the positive cases in our county. And so Latinos, as mentioned before, unfortunately, it still hasn't changed. We continue to be 50 or more % of the total COVID-19 cases. And so we are only 25.8 of the Santa Clara County population, however, make up the majority of the cases for COVID-19. And so some things that we need to continue to remember, that COVID-19 continues to be very present in our community, especially the Hispanic Latino communities in our county. Next slide. And in regards to the vaccinations, this week, as some of you might know, we had our numbers shift a little as Kaiser reported the numbers, and unfortunately the data at the time wasn't reflecting a lot of the Hispanic Latino numbers that were getting vaccinated at the time. Now these are the most updated numbers, and so although our population, the Hispanic Latino population in Santa Clara County, has gone up, if you can see, up to 40%. Now, we still continue to be the population with the lowest vaccination rate in our county. And so, although our numbers are going up, and that is a great thing, we still, compared to the other ethnicities and other groups in our county, we continue to be the lowest vaccinated population. Next slide. And this, again, is a map. I pulled this yesterday, and so it's the most updated map. Unfortunately, the numbers, again, continue to look the same. If you see the darker blue there, that means that in that area has the highest cases of COVID-19. And so here, you will see that the east side of San Jose, that area where the 680, 101 kind of overlaps with our east side, and you see the blue, and then towards the east, the numbers continue to be high. And then in South County, in Gilroy in particular, the numbers continue to also be high. And so that hasn't changed. These are the most updated numbers as of yesterday, April 27th, that were on our dashboard yesterday. Next slide. And so as we talked about, you know, our districts are reopening, our school districts are reopening here in our county. And on this specific dashboard, you will see, if you go there, you will see your specific district and what the details are to your particular district. And they are all listed there, all the districts within our county. So if you are not sure or want to know the details to any particular district, you can go there and access that information through the Santa Clara County Office of Education website. They have this dashboard up and available for us. Next slide. And then just a reminder that everyone, all individuals here in our county who are 16 and over, who live, work, or attend school in our county are eligible for a vaccine. And so you can make your appointment through the sccfreevax.org, or you can call 211 to schedule an appointment. And then also, we can go to the next slide. We have, actually, I'll talk about it in the future slide. We have certain locations this week that you can go and attend in person if you don't have an appointment. So I'll go over that in a few minutes. And then in regards to vaccines and, you know, our youth, as I mentioned, all youth ages 16 and over are eligible for a vaccine. And we are encouraging all of our members of our community, right, 16 and over, to make their appointments and get their vaccine. But most importantly, our youth, so that now that they're going back to school, some of them, now that there are activities such as graduations that are being allowed in person, and also things like celebrations with family and maybe elders such as grandparents or sometimes and I'm not sure if that's my internet or if we're on. Let me double check before I continue. In person. So I am live. Looks like I'm live. I'm back. We're here. Okay. So back to this slide. And I apologize for the technical difficulties here. As you know, we're doing this live and doing our best to connect with our community. And so sometimes we get to deal with some of these things, so we don't just record ahead of time and just hit play. So thank you for your patience. So back to this slide. Our youth who are fully vaccinated can go and attend events with less worry, like family events, promotional dance, their proms, that some of them might have, sports events, graduation events, work, spend time with friends. And obviously the safest is when everyone is vaccinated. So encouraging everybody to be vaccinated. Next slide. And so again, follow these core principles to stay safe, continue to stay outdoors, stay masked. On this specific website, I did capture a picture there. The CDC has this guideline as to when is best to be masked. And so if you go there, it'll break down certain activities, outdoors and indoors. You can go there for more information. Maintain at least 6 feet distance from others, avoid crowds, get vaccinated when it's your turn, get tested, and especially if you're a frontline worker or exposed to the public. And so you can make your appointment at the sccfreetest.org. Next slide. And so just a reminder again, the call center, 211 is our call center that you can call with any questions within the county. You can also call there for any questions or even support to get the vaccine. Now the 408-970-2999 number, you will have people answering your phones and supporting you specifically for the COVID-19 vaccine appointments, and then also any questions related to COVID-19. And if some of you prefer texting, that's also an option. You can text the message COVID-19 to 211-211. Next slide. And here's a slide I was talking about earlier. We do have some locations with multiple drop-in days this week. So we have the fairgrounds, which will be open Tuesday through Sunday, 8:30 to 4:30. County Service Center, open Tuesday through Friday, 7:30 to 4:30. Emmanuel Baptist Church, Tuesday through Friday, 8:45 through 4 p.m. Mexican Heritage Plaza, 10:30 a.m. through 4:30 p.m. And Wednesdays, 12 to 5. And then Gilroy High School, 8:30 to 3:30 p.m. Mountain View Community Center, Tuesday through Friday, 8:30 to 5:45 p.m. And then Overfelt High School, Thursday through Sunday, 10 a.m. to 3 p.m. And then Fridays and Saturdays, 10 to 5. And then on single day drop-in clinics, these are days that only these sites have one single day out of the week. Our Lady of Refuge, we left that on today. Obviously, we know it's Wednesday, but we may end our community forum today with still enough time for you to make it. You can drop in from 10 a.m. to 4 p.m. on Wednesday, which is today. And then also Milpita Sports Center. If some of you live nearby and are listening in and still need your vaccination, you can make it by 4 p.m. Drop in just today. Conexión, Thursday, that will be tomorrow from 10 a.m. to 5 p.m. and then the Tafatolu Congressional Church on Thursday from 9:30 a.m. to 4 p.m. and then St. John Vianney on Friday from 10 a.m. to 4 p.m. Next slide. Next slide. Thank you so much. So those are the updates in our county. And now I'm happy to give, if we can continue, I don't know if there was other slides on that presentation, and if there's not, that's fine. Quetzal, who's working the magic in the background, will let us know. Otherwise, I can just share the information on one of our community members. Her name is Araceli Ortiz Medina, and she's been in our community for many years. She is a mom who is involved with her children's education, involved with PTAs, involved with DLACs, involved with the schools and the districts that she's involved with. We're lucky to have her in our community. And with all that, she also finds time to tune into our community forums. And Araceli Ortiz Medina was on our community forum last week. If we can go to the next slide, where she asked this question, and she was on our Spanish community forum. And basically she asked, or she mentioned she wanted to get her vaccine, didn't know, hasn't been able to go in person, and also asked the doctor for information about her health in particular and how the vaccine can affect her. If we can go to the next slide. And so the doctor answered her question, and I'm happy to report that that night she actually made her appointment to get her vaccine. So congratulations, Araceli. She made her appointment that night, and she had her vaccine last week on Tuesday. So it's now been over a week. Checked in with her. She's doing great. And she posted this on her Facebook, and I asked her for permission to share this information with you all, and how excited we are for Araceli. She says, my first dose of my vaccine, I did it for me and for my family because I love them. And I want them to be able to be around the people who during this pandemic I have not been able to see. I miss them a lot. It was not easy to make this decision, but in the end, I did it for the love I have for my people. And she was feeling hopeful that day. So that was last Tuesday that she posted that. And I just want to say again, congratulations, Araceli, and that she was able to make her appointment, get her vaccine, and also share that it wasn't an easy decision for her to make. And when I asked her what that was about, if she wanted to share a little bit, she did mention that she had some health risks that she had to consider before getting this vaccine. But after talking to the doctor who was on live, she was able to ask her questions and feel at ease, and know that she would be fine once she got her vaccine. And so with that, I also want to let you all know that we do have Dr. Gerardo Solorio Cortez every other community forum, which is once a month. And our next one will be May 12th, where he will be present and will be able to answer any of your questions or concerns that you might have in relation to the vaccine. So thank you so much. Now, I want to introduce our amazing guest, Anya Artigas. Anya is currently the coordinator of mental wellness support services for the Alum Rock Union Elementary School District. She has a master's in educational counseling and a doctorate in education. I was fortunate enough to meet Anya over 15 years ago. Don't want to date us too much, but we did a work when I was doing some work with the at-risk youth in our city of San Jose. And so she was at the Lee Madsen community, and she was a part of the community crime prevention safety committee that the city of San Jose had at the time. So she was on there. She's an expert, and she's here to talk a little bit about our youth and our children. And what they're going through. It's a stressful time for us all. And so, and our children, unfortunately, sometimes need extra support to get through these trying times. And so, Anya, welcome. And I have some questions for you, but if you can just share a little bit more about who you are, if I missed anything or anything you might want to add with our community. Welcome. And Anya, you're muted in case you are talking. And we might have technical difficulties. Quetzal, is Anya there? Can you hear me? In the meantime, I'm going to read some of our questions and comments in case we're still on. So I'm going to go ahead and read some of our questions and comments. I do see some comments about 5G, and just reminding folks that today that is not our focus. So I will be focusing on the questions and comments around our segment here today. Are there plans for updating the social distancing business protocols? Some requirements seem now to be in excess of the recent modifications of restrictions. From Gretchen Lindsay Hull. And so Gretchen, absolutely, as you know, things are changing day to day, and we know that some of our counties in our state have actually moved to the yellow tier, and so we're looking forward to moving in that direction. I don't have specific answers specifically to the business protocols, but I will take note of that to bring in somebody in one of our next segments that can talk specifically to the business community and obviously COVID-19 in our county. Yay, Anya, welcome. Welcome back. I know this technical stuff is, I don't know if it was me or you all, but I'm glad you're here. So I went through the first question. We're going to go ahead and bring it back to you. I did a welcoming introduction, but if you want to share anything about you and anything you might want to add about yourself for the community to know more about who you are. Are you there, Anya? Can you hear us? For some reason, the audio maybe it's off. Okay. Anya, can you hear us? I don't think she can hear us yet. I'm hoping that she comes back in. Let's see. Can you hear me, Anya? You cannot hear anything. That's so interesting. Okay. And we had logged on earlier. I can definitely ask the questions. That's so weird. Let me, I guess, I will start off with the first question. Let's see. Okay, so as Anya hopefully is able to answer questions that I sent her beforehand, I can go back to the questions that the community might have. Quetzal, if you can help me, maybe just let her know that we're going to go down the questions that I sent her, and if she wants to put in her answers, to feel free to do so. This is unfortunate that our internet is not allowing her to connect by audio. But if she can answer the questions, then I can read them out loud. It's the same thing. Are you back, Anya?
I can hear you now. I'm going to have to do
Hey, she made her entrance. Nice.
Way to make an entrance. Thanks for that.
All right. Welcome back, Anya.
Thank you.
I was just letting our audience know that we're having issues, so I'm glad you're back. Basically, let's just take it back on. If there's anything you want to add about who you are, so our community knows who you are, I let them know your title, all the amazing degrees you have, and how you and I met doing safety work in our community many years ago.
Yes, doing safety work as well as, I have to shout out the first time I really was able to work with you, Karina, was when you, agreed to come out to the school I was working at that point in time, which was Fisher Middle School. You came out for one of our very, very first career days. And you were a constant participant after that, and the amount of work you did with our kids during those times in particular, you made a lot of impact. So we've known each other for quite a while and in a lot of different ways. And thank you for having me on board. I've had the pleasure and the honor and the privilege of working with Alum Rock School District and with our local community. I've been, working in the community since 2001. And honestly, there's no other place I'd rather be. There's nothing like an Alum Rock kid, and there's really nothing like Alum Rock families. They're amazing. Anyway, in terms of myself, I am the coordinator of mental wellness support services. I have been working in this capacity for 4.5 years now. It's been a pleasure to do this work as well and to really build out connections, within our district, going into the schools, as well as within our local community and county partners, as well as the county, to bring in as much support as we can for our students and families, especially during challenging times like what we've been dealing with for the last 13, 14 months of living within this, the times of the pandemic. And so that's just a little bit about myself and kind of what I'm able to do at in this space and the time that I've been within the community.
Anya.
Yes.
Anya, hopefully you can hear me. Let's take off your video and see if maybe the audio is better.
Okay.
Like that, and that we can at least hear you.
Sure.
And maybe this internet will. Okay, great. Thank you.
Is this any better?
Yes, a lot better.
Okay. All right. So I'm not quite sure what was able to come through.
I heard it all. Okay, I heard it all. I just noticed it was slowing down. So I wanted to keep this momentum going. Sure. And so with that, thank you for your patience and just doing the audio. How many students in the district in Alum Rock have returned?
So per our last gathering of numbers, we're looking at approximately 1,800 to 2,000 students that have returned for some level of in-person learning at our schools since we've reopened. But we've been working with our students virtually, since we went into closing down the schools back in March. So, but approximately at this point in time, since reopening with some level of in-person, 1,800 to 2,000 students are currently attending in person daily.
Thank you. And if you can just explain kind of what maybe a typical day for a kid or a week in distance learning, and then I'm understanding partial at school, what that looks like.
Sure. So what we've been utilizing, since the beginning has been really a hybrid model, and we're continuing to do that with an increase, like we said, in person. And so what you would normally see is we have students attending school Monday through Thursday. Morning time, there's multiple hours of synchronous learning that's being conducted virtually by teachers. And then they also have asynchronous learning time during the day. And usually what will happen at that point in time is teachers make themselves available. They hold office hours. Sometimes they will host small groups to, help deepen the learning for our students who might be struggling a little bit more and maybe need the extra support. And then, what we've added since our reopening has been 90 more minutes at the end of the day or close to the end of the day where in-person learning is taking place. And so of the 90 minutes, it's usually comprised of a lot of academic learning as well as support, but there's also components of enrichment as well as social emotional learning. And so that is normally what it looks like Monday through Thursday. Friday, many of the schools are doing a a lot of asynchronous learning, so that teachers have, again, the capacity to continue to meet with students one-on-one, and also meet with parents if the need is presenting itself. And so we're looking at, students being supported Monday through Friday.
Thank you. And then we know that it's stressful times, as I mentioned earlier, for all of us. But can you tell us, in regards to the students at Alum Rock, what kind of support services do they have when it comes to social emotional wellness support?
Sure. And so in terms of Alum Rock, just like we've done everything, when we we're looking at learning, we were looking at it from a very layered approach, because we want to make sure that we are finding ways to support all students, where it is they need to be supported. And so we took the same approach when we were looking at social emotional supports. Our layered approach started with the incorporation of social emotional learning throughout ARUSD during in-class sessions. And so some examples of that would be morning meetings that are conducted by teachers, utilization of social emotional learning curriculums such as Kamochis across the elementary schools, use of Second Step across some of our middle schools. So in terms of the social emotional learning components, that's what's available. Now, in terms of other social emotional supports, we've been really blessed to have some strong partnerships with the county, with the city, and with some, nonprofits that have really stepped up in this last 13 months. And they've been providing services, and those services are services that are provided when families are working with our quadrant coordinators who can get them connected. They have a really amazing working knowledge of available resources, how to navigate county supports, and also how to connect our students and families with those organizations. And I would be remiss in talking about social emotional supports if I didn't give a quick shout out to our school counselors across the middle schools. Our school counselors have been working diligently, providing telecounseling, also, creating counseling classrooms that kids can drop in for and connect with them. And we also have our counselor intern expansion program that ranges across all of our schools, where school counselor interns under my supervision are actually able to provide a level of counseling support for students at the elementary school, for elementary schools that do not have a school counselor present. And so in terms of social emotional supports, it is layered with some instruction, some curriculum, and a lot of individualized and small group through the counselor interns, as well as the organizations we work with.
Thank you. And this, what, I'm listening to you fine, and I'm hoping that this stays on. I'm wondering if we can have you back on camera and maybe it'll work. Let's try it.
Sure,
And
let's give it a try. Let's see.
Okay. So far, so good.
Okay.
And in regards to our children, how they express themselves, it's a little bit, sometimes in our face, sometimes not. But can you tell us some of the red flags for parents and guardians to look out for in our children that may indicate that they're in need of maybe mental health services? And if they witness some of these flags, what should a parent do? And is it different for younger children compared to youth age, a little older adolescent children?
Sure. So I think that there are some red flags that are going to be typical across the board, regardless of age. What I would suggest for parents to pay attention to for kids would be changes in patterns, right? So changes in sleeping patterns, changes in eating patterns, changes in terms of things that they may have been interested in, that they may have liked to do, and you see them like losing an interest in it or not really connecting with it. You might see levels of restlessness, struggles with focusing. You may also see increased anxiety. And the other thing would be low frustration levels as well. And so sometimes the low frustration levels, how that might manifest itself would be, your student getting frustrated with something that they may be learning that they're struggling with much quicker than they would have in the past, or getting frustrated with a new toy or a video game. And what you'll see like an increased reaction. So any of those things, in and of themselves would be a red flag. The other thing to look for, because something to keep in mind is that children will present differently, right? It's not just about the age, it's also about who the child is. Some kids will be externalizers, and so the behaviors that I just talked about, some of them, the low frustration, the focus, the anger piece that may be presenting, those normally are something that would be,
You know what, Anya?
yeah.
Let's put you back on. Sorry. And I don't know if it's
Okay.
just me, but I can hear it a little choppy. So I rather you were doing great without, or but we can hear you better without the.
Without
I
the
guess,
camera. That's okay.
and it might
I-
be me. So
Okay.
you go on, and Quetzal might take over, just so you know
Okay.
if it's me.
Okay.
Go
No
ahead. Sorry
problems.
for interrupting.
It's okay. So should I turn my camera off or leave it on? What's the preference here?
Go ahead and continue with your answer. I'm sorry
Okay,
for
perfect.
interrupting.
That's no, you're totally fine, totally fine. Technology has been nothing if not helpful but challenging through this time. So I totally understand it. And so again, like I said, some red flags to look out for, are going to be really behavior connected, changes in sleeping and eating, changes in just the regular behaviors you'd see from your student. And again, just keeping in mind that kids are going to be impacted differently and they're going to present differently. So where some kids may show their frustration level, and an increase in it in the way that they react, other kids might become very internalized and you might start to see some issues with isolation. So if you're seeing any of those things, some of the things that I would suggest, first piece is just sitting down with your kiddo, with your student, and just having a conversation with them. There's some power in stopping our day, sitting down and just checking in, and the questions, they can be the most simple, basic questions like, how was your day? Tell me what was good about your day, especially for little ones, right? Tell me what was good about your day. What you like about your day. What made you happy today? What made you sad today? Right? What could have been better? Okay. The other thing is, if you're noticing a pattern in terms of the behavior for your student, having a conversation around that. And maybe the conversation looks like, I've noticed that you haven't really been yourself lately. I've noticed that there's been some changes for you. You want to talk about it? I can listen, and maybe I can even help. Right. So just, I'm a firm believer in just, taking a really honest approach with kids, and sitting down and just having a conversation with them. Because a lot of times kids, when given the opportunity, can tell you some of what's really happening for them. Obviously, if they're younger, that's a little bit more difficult. Um, but the good thing is that there are a lot of people, within the school district as well as within the county, that are ready and positioned to help and support our families, because we acknowledge, and understand how difficult the last 13 months have been, for our kids, for our families, and for our community at large. So, just some suggested tips. But again, if you need support, if you're concerned about your child, reach out to your school. There are a lot of people that are, ready and willing to connect with parents to help you find the support that you might need for your student.
Great. And I went off, so I think it might be my video and my connection over here. So we're going to try it this way. If not, Quetzal is going to jump in as the
Okay.
amazing public information officer working behind the scenes here.
Okay.
So I'm not sure if she asked any of the future questions, because she has those too prepared, of course. But I'm going to ask this one, and if you already answered, let me know. How can parents support other parents that might be struggling with a child with mental health um, illnesses?
Yep. My recommendation would be, like, in terms of parents supporting other parents, here's the first thing I'm going to really put out there, Karina. It's important for us to support, the other parents around us. It's important for us to support our neighbors, and be very community minded. But it also has to start with us. We need to make sure that before we're providing support for other people, that we're also providing support for ourselves, and that we're also, taking the time to show ourselves compassion and caring, because just as much as other people are struggling around us, there's also internalized struggle for us. So starting point for me is always making sure that you're also practicing some level of self-care. The other thing would be, how can parents support other parents? Sometimes it's as simple as having the other parent understand that they're not alone, like that the struggle that they're facing right now, is something that can be related to, because they may have had the same struggle or something similar. Holding space for conversations, and listening with compassion, and also assisting uh, your fellow parents or your fellow community members in connecting with resources and supports that are available for them. Starting point for a lot of parents can really be our school campuses. Whether or not there's a school counselor on campus, administrators have really great listening ears, and our administrators, particularly in Alum Rock, they're amazing, um, incredibly supportive, and they really care deeply about the kids in the community. So starting point would be talking to somebody at the school, either a community liaison or the administrator, or if there's a school counselor, the school counselor, and asking them to help that parent to navigate and get the support that they may need, whether it's for their child, for the family at large, or maybe some resources they need to come into the home, around food or what have you. The people at the schools are well positioned to really provide support. Um, so best way for parents to support other parents is to help them to sometimes have the conversation to ask for what they need, because sometimes that's the very first step, and sometimes that's the most difficult step to take.
Thank you. Uh, Very important information. You kind of touched on my next question a little bit, but if you can reiterate. And before I ask it, I just want to remind our audience that if you have any questions for Anya, or myself, or Quetzal at this point, if something happens to me as a public information officer with the county, please put them in the chat and we will do our best to respond to them. So with that, what if I'm a parent and I'm listening in and some of the things you mentioned resonate with me? Maybe my child might be experiencing some of that and we still haven't gotten any support, or maybe as a parent I haven't reached out. Who
All right, I think we're continuing to have some technical difficulties on Corina's side. So I will just continue the conversation from here.
Sure.
What Corina was bringing up was, we talked about how to support parents, how to get the resources that we need. And as you talked about being from Alum Rock School District, for those who are viewing today and are not part of Alum Rock School District, what is the title, or who is that support person for families to look for within their districts?
Sure. And so I'm referencing, what I understand to exist at a majority of the districts. So a majority of the districts, across Santa Clara County, there is either going to be somebody that's doing some sort of parent resource work. So for us here in Alum Rock, that title is a community liaison. That could be a starting point if we're looking at school site connecting, right? So community liaison or parent resource, because like I said, they have different titles across different districts. Or you could also reach out to the school counselor. Some districts have school social workers in place of school counselors, so they could also reach out to the school social worker. Administrators are also another starting point. If we're looking at having parents reach out and their comfort level is reaching out to people that they know or interact with, school site would be the beginning point. If they're wanting to go to the district level and ask for support, I would say the starting point should always be the department that's serving student needs. And that's the majority of our departments, but student services normally across the board, across districts, is the one that is more focused on bringing like direct supports around counseling and such. And so I would, suggest that reaching out to the student services department in your school district could be another starting point. For those, folks that, are open to navigating technology or exploring technology a little bit, or doing some outreach via phone. I know that in the past, the county has had a 211 number that parents can resource, and you call them and you talk to them about what the needs are that are presenting, and they can give you some folks that you can connect with that could possibly begin the process of supporting or finding supports for you. And so those would be just some of my suggestions. The county, like I said, is really rich in terms of the supports that are available. And so I would just start at the schools if that's your comfort level. If not, I would go to the district. If not, the county, like I said, it's they've made it easier and easier over the years to navigate the services that are out there for families and for children.
And I'm back.
Welcome back in the
Went on our
space.
journey and I'm back. Man, I tell you, like, it makes me think of our poor children, right, who are logged in, who've been distance learning for such long time. And whether it's, the teacher being logged off because of the connection, because I forgot my husband is also working remotely, and we're both using the internet, and then our children, and then it's like that alone can create the mental health, right? Like instability, like, oh my God. So just one of those opportunities to realize, as a parent, right, as an adult, I can get up and say, you know what, after this, I'm going to take a walk. I need some air. I'll be back. But my 12-year-old daughter can't be like, I'll be back. I got to go, I'd be like, wait, come back. And so just, also, I think Creator made it all happen. So, as parents, we could see like, this is frustrating, right? And how do we respond also as parents to the need of our children that sometimes even as adults, we can't like comprehend some things.
Mm-hmm.
And then not to mention, if one of our family members are dealing with or ourselves, COVID-19, or, all these other stressors that are out there, losing jobs, that then, can go to losing your home. Where do I get food from? How am I going to feed my family? And, our children vibing off of that, right? Like that emotional state. And so I'm back.
Welcome back into the space.
Thank you. And thank you for sharing all those resources, Anya. And we know that you are obviously focused to Alum Rock, and we're blessed to have you at Alum Rock. But we're also glad that you're sharing, that there's somebody in every district, right, that's there to support our children through whatever the need is. So I don't know if the community heard me, but I was encouraging them to ask questions. So far, there's no questions that I see, which means that you're just doing a great job of providing that information. So thank you so much. And in regards to the last question here, that I had was, are you familiar with any specific funding coming in to support youth in this new phase or reopening of our schools? And I'm not sure. Okay. Did you hear my question? Sorry about that.
No, I think it was
Okay.
my turn to have problems with technology. So go ahead.
No worries. And we'll be done shortly here. Do you know, or are you familiar with any funding that has more recently come in to help support our schools, our youth in this new phase for reopening schools, but specifically focused on mental health support?
Mm-hmm. So I know that there is, I know that the state of California has really been looking at the mental health of our students and how it's been impacted and affected. And so I know that, there is going to be some funding coming towards beginning to address, some of the supports that might be needed. I'm going to tell you, Karina, that I'm hesitant to speak more on it because I want to understand it more before I bring it out into the space and have a conversation about it. So I know that there is some level of funding that's going to come through, as a support because of what people are like currently having to deal with around COVID, but I don't have the details of it, so I'm hesitant to speak on it.
Yeah, no, that makes sense. Well, thank you so much in answering all the questions that we had for you. And I'm going to encourage our audience, if there's any questions there that you might have for Anya or myself as a public information officer, that we can assist in answering. Otherwise, again, you did a great job in answering the questions and providing the information that our audience are probably like, we're good to go. And I also know that unfortunately, based on one of the many other hats that I wear, right? I'm a reassigned disaster worker here in our county, but I'm also a probation officer within our county. And so maybe, Anya, before we go, if you could talk a little bit about what happens when some of these needs aren't fulfilled in a healthy way, right? With the social emotional support that our children might need.
Sure. I think something that we need to look at is that when we aren't coming into the space, when I say we, I'm saying we collectively as a society, as a community that serves and supports children, when we don't have opportunities to provide supports for children, for them to process, what they may have experienced, and for them to begin to find ways to heal from what they've experienced. One of the things that unfortunately presents as an option for kids is the utilization or the using of like maladaptive behaviors, right? So when we're talking maladaptive behaviors, we're talking about, sometimes kids may, the maladaptive behaviors might present itself in them trying to find ways to escape. Sometimes the escape, is with cigarettes, with vaping, with drugs or alcohol. Sometimes it leads to them engaging in activities that are illegal, that could, result in them getting in trouble. Unfortunately, when we are not able to provide the supports within the space, that are needed, sometimes kids will find their own way to deal with what they're feeling or to not deal with what they're feeling, and that's when the concerns increase, because the more that they engage in these type of behaviors, the higher the risk becomes. And so I would just really strongly suggest, please, parents, ask for what you need for your kids. Reach out to the people that are able to help you and able to provide the supports. We want to bring those supports into the space, but we need to know that it's happening. And kiddos, if you're listening, if you're going to watch this, let your parents know that you need the help. There's absolutely no shame in asking for what you need too. If you need help, if you're struggling, if this has been hard for you, and I know it has been for a lot of you, let your parents know, because your parents love you the best way they know how, but they're not always going to be able to tell if you need the help. So please take a minute, talk with your parents, and let them know what you need.
Thank you so much, Anya. And I really appreciate how you also talked about parents, right? Us getting the support that we need. Because when we model that behavior, then it becomes easier. And we all have something to talk about or heal through or work on. And sometimes it's those things that we heal as parents that allow our children to also heal here.
Amen.
So thank you. And I do see a couple questions here, and they're related to Santa Clara County. And so Karen Pericone is asking, is there an update regarding no longer requiring fully vaccinated people to wear masks when not swimming at an outdoor condo pool? So I don't have specific answers on that. I did mention the CDC guidelines in regards to wearing masks and not. I'm going to assume that it is on there, but I will look into that answer, Karen, and I'll respond to you in a written form after our forum. So I'll look into that specific to our county. And then Gretchen Lindsay Hull asks or mentions, apologies if this was answered earlier, but how close is Santa Clara County to meeting yellow tier requirements? So that was not answered, Gretchen, and that's a very good question. I don't have the specifics of like how many days we're from it. My understanding is that we are close to it, but I don't have a timeline for you as to how long we're away from it. If it's next week, if it's in 2 weeks, my understanding is that we are close to it. But I can ask as well. I'm only a public information officer, and so I can ask my supervisor and managers to see if we can get a specific answer to that. And then Gretchen, I'll also respond in writing. So thank you so much for your questions. If I don't see any others, thank you so much, Anya, for coming on and for being so patient with our technical difficulties here. Shout outs to Quetzal, who's working the magic in the back and making this all happen and jumping on, when I wasn't on. And, the rest of the teams at the front lines, right? In one way or another, whether it's the grocery stores, the gas stations, working with our children, as you are, Anya, the public information officers, trying to do our best to get this information out to our community as best and in a way that, is connected, right? And it's not just something that I record and I hit play and I send it out for people to listen to, which is great to get that information out in that way too. But I think it's also important to connect with our community and give you all the ability to ask questions in a live manner. So thank you all for your patience with us and dealing with that format. Anya, is there any last words that you'd like to share before we close?
I'm just always going to remind people, that it's really important to practice taking care of yourself, right? It's what you said earlier, Karina, that, our kids, they follow what we model. If we want our kids to take care of ourselves, it has to start with us, and you deserve it too. So parents, make sure that you are taking care of yourself because you deserve it and because your kids are watching. That's all I got.
Thank you so much, Anya. And for the rest of you, thank you for tuning in, and we'll see you again in 2 weeks on our bi-weekly community forum. Just so you all know, we do host a Spanish one at 4:00 on our Spanish channel. And so if you have any family members or know anybody that might be interested in tuning in to hear some of this information in Spanish, you are more than welcome to tune in then. Otherwise, have a great night, and we'll see you in a couple weeks. Take care. Good night.